and welcome to the Postpartum Years podcast. I'm your host, Dr. Ellen Kramp, and I'm a physical therapist and a pelvic health specialist. Today, joining me is Swathi Raman. She is a mom and a pediatrician, as it happens to be. And I would like to welcome Swathi. Swathi, I would like to hear about your birth story and then postpartum issues that you've been experiencing since. So go
Sure.
ahead and tell me about what's transpired.
Great. Thank you so much for having me on and providing a platform for women to be able to share about their stories. So I had a pretty uncomplicated pregnancy as far as the medical side was concerned. I was pretty miserable the whole time, but it went well. I had an induction at 39 weeks, and the epidural was a little too strong, so I had a lot of blood pressure issues, and the baby's heart rate was dropping, and it was a really prolonged process that I didn't expect to happen. And then when it was time to actually deliver the baby, she got stuck, and there were a lot of people in and out of the room. And in healthcare, you kind of know when there are a lot of people in and out of the room that's not good. And my husband, who is also a physician, was looking at me, and we were both kind of freaked out. And eventually I managed to push her out, because the next step would have been an episiotomy and a forceps delivery, or possibly a C-section. And in my head, I was like, oh no, we're not doing that. So I pushed and I pushed and I pushed, and I probably pushed too hard because I couldn't feel anything. And my child was a little stunned at birth. She needed a little bit of CPAP and resuscitation. And I had a lot of sutures that needed to be repaired. And overall, she did well in the hospital. And I not so much.
How long did you have to push for?
3 hours.
That's quite a while.
Yeah, it was a lot, and each time I pushed, her heart rate would drop. So I was constantly being turned, and it was an experience that I did not envision happening. And it's something that I still kind of struggle with.
How long ago did you have her?
She's 10 months old now.
Okay, so that's still fresh for you.
Mm-hmm, absolutely.
Okay, now tell me what happened with you. You said you needed a lot of stitches. What other issues were you left with?
I think I was just really I don't know how to say it without just not sounding very nice, but I didn't feel like I got very good postpartum care, to be honest. I had a lot of stitches, and I kept being brushed off as my pain was normal. I couldn't have anything other than Tylenol or Motrin. And in the postpartum floor, I was in so much pain I couldn't move. And I kept calling out to the nurse. My husband kept calling out to the nurse. And not a single clinician or provider ever came to check me. They would just send messages through the poor nurse, who's just, she's trying her best, but she can't really make these decisions. And I remember my husband and I asked, why can't I have a dose of Toradol, which is like an IV version of ibuprofen? And the response I got was, we don't do that here. And I was like, I have an IV in. I'm also a physician, so don't tell me you don't do that here. And they never really came to check on me. And I went home in a lot of pain, and I just kept being told, it'll get better, it'll get better, it'll get better. It didn't get better. It just kept getting worse and worse and worse until postpartum day 5, when I asked my mom, who was staying with us, if we could order a cane off of Amazon so that I could move. And she looked at me and she said, "You have to go back to the OB right now." And I went back and to the OB office, and they weren't even able to examine me because I was screaming bloody murder the entire time. So then I ended up getting readmitted to the hospital for a pelvic exam under fentanyl because I couldn't tolerate it. And I got admitted again for a soft tissue infection and was on IV antibiotics, IV pain medications, and not with my baby. My baby was at home
At
with my
home,
mom
yeah.
alone for 2 days. It was just a terrible, terrible experience. And I'm still dealing with the pelvic floor dysfunction that's come with that. Now I'm on like a third pelvic floor therapist and hoping that this makes a difference at this point.
Oh, oh.
Yeah.
As a pelvic PT, my heart
Yeah.
like just
Yeah.
really goes out to you.
Thank
Um,
you.
so what issues are you having? I mean, other than pain, are you having any urinary issues, bowel issues?
I was having urinary issues, a little bit of leakage, and also difficulty emptying
Hmm.
initially after birth, and that resolved pretty well. I have a lot of like pain when I sit down, pelvic heaviness, and I would say the discomfort with like bowel movements is really pretty bad. It feels like I have to go, but I'm not emptying my bowels, and it I just constantly feel uncomfortable. It's gotten better, I will say, because before it was so terrible that I couldn't even hold my child for the first month of her
Hmm.
life. And now she's way bigger and we play and I hold her, and so I'm in a much better situation now, but um a lot of the bowel issues and tenderness from the scar tissue has persisted.
That is really rough. I mean, I see
Yeah.
that every day
Yeah.
with what I do. I feel so badly that you went through all of that pain for so long that 10 months later, you're still dealing with that. Because
Yeah, and with no OB follow-up.
yeah,
So,
that's just
yeah.
wrong.
Yeah,
Um,
I agree.
yeah.
And I think it still bothers me because I ask myself, if my care was so haphazard and I'm a doctor,
Hmm.
what is happening to other women in the hospital who don't have the same amount of familiarity that I
Right,
do?
right. And plus, at that time, I mean, you needed your husband as an advocate as well, even though you are a physician, because you were in so much pain
Yeah, yeah.
that you couldn't advocate for yourself, even though you knew exactly what you wanted, exactly what you needed.
Yeah.
Um,
So
y-
he was my advocate and I was the baby's advocate. So as a pediatrician, I'm sitting there saying the way that you guys are checking her bilirubin makes no sense. You're not following the AAP guidelines. And then like going off on them about that.
Now, are you breastfeeding or um, were you able to breastfeed? Is that a choice that you had made? And how did that go?
I really wanted to breastfeed, and I was so proactive about seeing a lactation specialist before I even delivered to set myself up for success. And that did not go the way that I envisioned it would go. I didn't get any support while I was in the hospital from lactation. We came home, and the baby's latch was really, really painful for me. And my poor mom was trying to be my lactation counselor. I feel so bad for her. Because she breastfed both my brother and I, so she was just trying to help me with whatever she knew. But the baby was constantly fussy, always hungry. So we ended up having to do a combo of formula. I worked with lactation. We were put on a triple feeding schedule, which is
Is
a special
hell.
type of hell that I won't wish on anybody. And you really feel like a one-man dairy farm
Yes, you
at
do.
that, a one-woman dairy farm, I should say. And we did triple feeding, and then I was just, my goal was always to continue to breastfeed her. So it took about 10 weeks to really figure it out, to be able to drop the triple feeding. And again, that was because I found someone on my own who had a different approach to nursing. This woman actually lived in Australia and did
Wow.
a video call with me at 9 p.m. and watched me feed. And since then, breastfeeding has been so much easier.
Good.
We still ended up going back to combo feeding because I wasn't sleeping, and I went back to work at 4 months postpartum, and it just wasn't getting a lot when I pumped, and the stress of it was also decreasing how much I was getting. And so I was waking up at like 2 or 3 in the morning every night to pump for 30 minutes. And I just couldn't function anymore. And my mom, who, as I told you, is like the breastfeeding champion, was like, "You're driving yourself insane. You can't do this." So right now, I'm combo feeding. So breast milk and formula if needed, but she's also eating a lot of solids. So
Good.
that's been a big change.
Good. I figured, just listening to how the first part of your postpartum journey was going, I'm like,
Yeah.
oh, if you were trying to breastfeed, let's hear how
No
this
one
went,
told,
because that,
and no one told me that like trauma and stress would have decreased my milk supply. No
yes,
one told me this.
yes,
And
that's why I'm trying to get this out there.
we even, my husband and I are privileged enough to be able to hire like a postpartum doula to come to the home and take care of the baby so we could sleep. And we went with a certain group that was well known for having doulas who knew about breastfeeding. And the first doula came in, and I'm hormonal and screaming and crying. And this child is so upset because she can't get milk. And the doula walks in and says, "Oh, I don't do breastfeeding. Let's just order a nipple shield from Walmart." I had a lot of 4-letter words that I didn't want to say, but I did want to say. So it was just like, now I laugh about it, but it was really, really a
Traumatic.
really terrible, isolating, traumatic experience all along.
Yeah, and I bet this has given you a really completely different perspective when
Yeah.
dealing with the parents at work
Yeah,
with these new
absolutely.
babies.
Absolutely. So I see a lot of strung out parents, and they're exhausted and burnt out, and their kids have a lot of different needs, and I see it very differently now.
Yeah, yeah, that's it's a challenge that you can't even comprehend unless you've
Yeah,
gone through it,
I think so.
especially when you hit multiple really rough patches like you did, because you're trying to heal from the pregnancy,
Yeah,
because that's its own thing.
right.
Um, and I think that's where the 6 weeks postpartum thing comes in, because the rest of it, you're still dealing with postpartum stuff 10 months later easily. And
Yeah, yeah.
so to me, it's always kind of made me
And it
chuckle.
also, yeah, and it also depends on what you count as healing from the pregnancy. If it
Hmm.
means like somewhat normal functioning, well, that's, you need follow up till like maybe a year and a half out.
Hmm. And then depending on the traumas your own body experienced, it can be longer.
Yeah,
It can be
which
longer.
I'm learning firsthand now.
Yeah.
Like none of this went to plan,
No.
essentially.
No.
Yeah.
So that sounds like a fairly rough journey. And
Mm-hmm.
knowing that you're still having pain with sitting,
Mm-hmm.
what about walking?
I'm able to walk more. I remember I used to take walks around the block, and if I could go 50 feet, that was like an accomplishment for the day. Now I can go around town pretty normally. I usually go on like 1 mile walks, 2 mile walks, that sort of thing, or going shopping. That's fine. It's really things that put a lot of pressure on the pelvic floor muscles that are difficult. So sitting in a car for a long time is hard. A lot of bending over lifting the baby,
Mm,
engaging those core
that's,
muscles.
hmm
It's a lot, especially now because she's way heavier and very wiggly and
hmm So it's not a
and
matter of
all
just holding, it's holding.
exact. It's like wrangling more.
Yes.
I should say that. Yeah, yeah,
Now, with the pelvic floor issues, have you been able to get back to a sex life?
barely.
Yeah. Yeah.
Yeah,
And that's another thing that a lot of women who haven't been through childbirth don't necessarily expect. Some, yeah, a couple weeks later, they're bam back to a normal sex life. But when there's been an issue where, you're screaming in pain for days, you have an infection, you had stitches,
yeah,
things weren't under control, you probably, the pudendal nerve is probably irritated pretty significantly on you.
yeah,
Those women can have a lot of difficulty getting back to a sex life
yeah.
because of that pain, and then the anxiety that it brings because
I
you
think
can't fathom.
it's more the anxiety because I don't think um, sex has been as painful as I thought it would be.
Good,
And
good,
we are really, my husband's like very supportive, and we just kind of like feel out what works for us. So it hasn't been uncomfortable. I think the
good.
big limiting factors are obviously we're really tired new parents, and and I think more than anything he's really worried about hurting me. So
Yeah,
yeah,
there's that aspect to it too.
yeah. So and it just feels like there's so much more deliberate thought that we have to put into it. It's not the same.
Yeah,
So there's a lot of mental work and like time that we need that wasn't the case before we had children. So it's been tough.
yeah,
And I mean, to be very frank, like I just still feel like broken, like feel like a
yeah.
broken person.
Yeah. Yeah, but the good news is it's almost always fixable.
Oh, that's
Eh,
good because I feel like I have Frankenstein's vagina. So, like, it's just like all stitched up in random places and somehow puttering along. So, yeah.
Yeah, there's a lot of hope out there.
Yeah.
I've seen many a broken vagina get fixed.
Yeah. Yeah. Thank you. That makes me feel better.
Yeah.
And I think the fact that like all pelvic floor therapists are not created equal
No,
also
no.
makes it challenging.
Yeah.
So the first pelvic floor therapist I saw was amazing. And then we moved, so I switched to someone who was closer by, and it wasn't really doing anything. And I felt like, well, I have the exercises, I know what I'm doing. So I stopped going, and then now I'm backsliding.
Yeah.
And then I found a third pelvic floor therapist, and with a much more holistic approach. And
Good.
their entire practice only does pelvic floor therapy. So it's been going well so far. I'm hoping that this really helps me feel better. Um,
Yeah.
But I also feel like it's important to point out that it's not just about pelvic floor therapy, but the fact that there's not much follow up to see if there's just something structurally going on that needs more intervention. I'm very, very privileged because my husband comes from a family of physicians, and his cousin, who is a urologist but focuses on urogynecology, was like, why didn't anybody refer you to a urogyne? He was like, what if you need scar revision? What if you need more than PT? Like, where's the doctor that's following this? And I said, what doctor? Yeah. I'm the doctor that's following this. Yeah. So it's been really tough to just be going at it alone this whole time. And I appreciate way more why people hate the medical system.
Yeah, it's understandable. But there's also even more help out there. I know just about a block and a half away from my office in DC, there's a regenerative medicine office, and there's a PMNR doc, a physical medicine and rehabilitation doc, he's using ultrasound and he's doing PRP injections.
Wow,
So
interesting.
It's protein-rich plasma injections.
Yeah.
And the PT who owns the office where I'm working, she's been working hand in hand in him and doing research. And he's got like the $30,000 ultrasound machine that's like super high resolution, and so he's looking for soft tissue defects post-birth and injecting those. And so between the pelvic PT that we're doing, we're very much manual therapy focused in our office.
Right.
Because some pelvic PTs are very exercise based and some just do telemedicine, which as a manual therapist, I haven't figured that out yet. So she's working with, his name's Imran Siddiqui, with Dr. Siddiqui on really fine tuning how where he's injecting, because we will go in and show, okay, we're feeling defects here. He'll look with the ultrasound. Okay, I see that there. He'll do the injection
very
there.
cool.
We will. So it's this collaboration between us and the regenerative medicine office to really work with them to get that pelvic floor as good as possible after birth. And it's pretty amazing, the results. And I'm hoping to interview Dr. Siddiqui later on.
Wow. Yeah, that would be so
to get
interesting.
that podcast out there. But
that sounds amazing.
he's doing some amazing work. And to feel those women come back into the clinic a couple weeks later, I can feel the changes within the muscle. I can feel the changes even within the fascia. So the fascia, that connective tissue that's supportive, it has contractile property to it, and it can be off and really unsupportive, or it can be on and supportive as it needs to. And it's just really neat to see things just perk up and be more supportive and fill in, and the muscle be able to contract better. And so I think it's just the most amazing collaboration that's happening. So, even beyond the pelvic PT you're getting, there's even more out there beyond urogyne. Urogyne's a really important aspect too. If a woman's having issues with prolapse, or they need a scar revision, or things like that, they are fantastic for stuff like that. And we refer back and forth to urogynes as well all the time. But yeah, there's so many more options out there for help and getting your pelvic floor back to feeling well, so you don't feel it, and so it functions the way it should. So it's cool. All right, do you have anything else you would want to add for people to know?
This has been a really huge learning experience for me, in terms of, like I told you, trying to understand what people who are not in the healthcare space feel and go through as a patient. And it sucks being patient. And it really does, especially in our American system. Like, we're not really set up very well for this. And I think women's health, especially, there's a lot of fighting and self-advocacy that you have to do constantly, and it's exhausting. It's absolutely exhausting. And I just hope that by, your podcast and a lot of other pelvic floor people out there like Sarah Reardon and all those folks, like that, there's more awareness about this issue, and that there's more, not normalizing, but understanding that it can take a really, really long time. I think we're all painted a very rosy picture of, oh, 12 weeks, you're going to do this and you're going to do that. And I had friends who were going on walks with their kids at 3.5 weeks postpartum. And for some reason, I kept thinking, what's wrong with me? What's wrong with me that I can't do that? Because that's what I thought was
because there is something wrong.
Right.
No,
but
they were the normal ones. You needed help. You needed some significant help.
Exactly. But what I was told was, that's expected, that's expected, that's expected. So I'm used to telling parents in my office, especially moms, to always trust their gut. And even if someone writes them off as saying like, oh, nothing's wrong with your kid,
second opinion.
Just get a second opinion. Absolutely. And so I would just share that for any woman who's also like experiencing persistent pain, urinary issues, whatever it might be. I've had friends I've talked to about my experience who then say, oh yeah, I've been peeing every time I go to the gym for 4 years. Maybe I should see a pelvic floor therapist.
Yes.
So,
yes.
Yeah, exactly. So, I think it's something we don't talk about enough. It's something that we should talk about, and that the pelvic floor shouldn't just be a postpartum woman's concern. Every single person has a pelvic floor, and I think we really, we really need to do a better job of disseminating that information, and also being proactive as healthcare providers about referring to pelvic floor therapists, because there are some OB/GYNs who won't refer you to pelvic floor routinely. And I feel like that should be a must for everyone. You should at least get checked out once or twice.
Yes. Yeah.
Yeah.
We've been saying that for years, and it's picking up momentum. But 20 years ago, when I first started in pelvic PT realm, I remember meeting with a midwife, and she said, don't even bother to talk to the OBs in this county because they will never refer to you. They're too conservative. So 20 years ago, and that was in Florida, but yeah, I mean, it was really, really hard to get those physicians to refer.
I'll tell you, as someone who went through medical school, I learned zilch about a pelvic floor in anatomy class. All the education I had about pregnancy was more related to fetal outcomes or, medical conditions. No one talks about the emotional toll, postpartum depression, postpartum difficulties, pelvic floor dysfunction. I hadn't heard of any of this until I did my own literature searching. So I do think that medical education places such a low emphasis on the holistic part of women's health and how, childbirth can affect every single aspect of your psyche and your life. And that's something that we, as the field of medicine, we need to do a much better job.
Yeah. Ironically, my GYN, she's since retired. So she was probably in her 60s when she told me this, and this was probably about 7-8 years ago. She had said she never received any education on the pelvic floor. And I'm like,
I'm not surprised.
You're a GYN. You are an OB/GYN. How as an OB/GYN did you not learn about the pelvic floor? Like, you have to sew up those muscles. Like, I mean, your patients, would have grade 2, 3, 4 tears. How
Yep.
did you not learn the exact configuration of how those muscles go when you have to sew them?
Yeah. It's pretty terrifying when you think about it.
Yeah.
Yeah.
Alrighty. Well, Swathi, it's been an absolute pleasure.
Thank you.
I'm so happy that you were able to share your story. I hope you continue really well in your recovery because there's, so much more that can be done for you. You should be able to feel like you have a normal pelvic floor again. You shouldn't be dealing with pain with sitting and picking up your daughter
Yeah.
and such.
It's
So,
it's it's definitely taken a large like mental toll on me too.
yeah, yeah,
Um and I have a job where I'm on the floor playing with kids. I can't do that anymore, and it's really disappointing.
yeah. Wow.
But I'm optimistic. We'll get there.
You'll get
I'll
there.
get there.
Yeah.
Yeah. Great. Thank you so much for
Thank
having
you.
me.
Thank you
All right.
very much. We'll see
Bye.
you next time in the postpartum years.
Bye.